I'm assuming everybody, Nadia, can you see that presentation okay?
Yeah, I can see it. I can see it.
So as you may already be aware, today we're going to be covering chronic pain management and prevention. And what I've tried to do in the workshop, as you'll see from the agenda, is try and cover as much as I can, with the prevention and management side of things, as well as what causes, pain in the first place and when to contact a healthcare professional. So just to introduce myself, so my name is Samera. So I am a radiographer, a chiropractor. I'm a senior lecturer, and as you can tell, I also do public speaking as well. I have qualifications in diagnostic imaging, in chiropractic, and I'm in the process of completing my PG cert in higher education, teaching and learning, and also a pain management, PG cert in the pain management, as well as just started my MSc in medical ultrasound. So a lot going on in my plate, but it doesn't stop me from anything. And as you can see, I'm registered with all sorts of health professional bodies. So what we're going to cover. So I'm going to introduce what the normal spine should look like in a normal structure and normal joints, and what are the causes of back pain and why we have the term referred to as wear and tear in our joints. And the factors are things like lifestyle, which I'll cover, poor posture, poor ergonomics, and then in the prevention and management side of things, I'm going to go through some exercise and rehab and the benefits of chiropractic care, and then towards the end of the presentation, to top tips to take away from the presentation, again, the importance of staying active, what's a good posture, what's good ergonomics, and some stretches that you can do. And obviously, if there is anything else apart from what I'm going to cover, we'll try and cover those towards the end as well. So I'm not sure how many of you are aware, but so the reason why we picked up back pain specifically, so this week is what we call the back pain care awareness week. So we thought it would be quite relevant to talk about pain, more specifically back pain, as a chiropractor, this is what I see most commonly, patients coming to see me for back pain and neck pain. So going through the skeletal structure. So your spine is made up of 3 sections. So as you can see, your top section is your neck section, which has like 7 vertebrae. And then your midsection is what we call the thoracic, so your mid-back. And then you have your lower back, which has 5 sections in it, and then your sacrum and your coccyx. So this is from a side view of the spine, and then this is looking at it from the frontal, and this is looking at it from the back. So the frontal view in the middle, you can see the yellow areas coming out on either side of the spine. And these are basically just your nerves that are coming out of each section in between your spines. And these blue bits on the right-hand side of the spine, on the side view, or the middle view, in between it, you can see the jelly-like substance, which is called your discs. So most often when we have any issues or any problems, most often it's either the discs that get damaged or the joint outline that gets damaged in between. So, there's a lot of wear and tear that can happen in the outer structures of those segments here, as well as the areas where the nerve roots come out from. Not sure if you can see my pointer, but basically this is where the damage will happen here, around the edges here, and then the discs. Can everybody see my pointer?
Yes, I can see it.
Okay, cool. Just so I know when I'm pointing, people can kind of relate to the same thing. Okay, so the next slide then, we talk about the causes of the back pain. So what causes the back pain? So again, talking about the outlines that I mentioned earlier. So you've got your discs. These are what we call the facet joints, which are most commonly, they can get inflamed and irritated, which can be the cause of back pain. The other thing can cause back pain is a disc, so either a herniated disc or a bulging disc. And this is just a 3D structure of a disc to kind of describe where the damage can happen. What also can play part in lower back is inflammation of what we refer to as your sacroiliac joint. So these joints are around your pelvis area. So most often at the back, you can see or you can feel them as the pointy bits or the most prominent bony protuberances around the hip area, the dimple part. So this is the back of the sacroiliac joint, which attaches to this structure here, which is referred to as your sacrum. Your spine stabilizes on these joints here. So if they get inflamed or irritated, then this can cause back pain as well. Now, back pain could be incidental. So sometimes I have patients coming to see me and they say, oh, I've had this back pain. It's come on suddenly. I've literally just woken up with it. Now, this isn't necessarily the case. It could be accumulative activities build up of causing the back pain, which then you kind of, patients say I've woken up, or I've bent awkwardly, or I was lifting heavy weight and my back went. These are basically the cumulative repetitive strain leading up to the activity that you may be doing at the point that is causing the back pain. It could be gradual, so more often the gradual onset would be more related to your wear and tear. So that could either be due to poor posture or prolonged sitting in uncomfortable positions or repetitive strain. And by these, I mean, so poor posture could be your changes over time that you adapted. So some people, they just slouch. Some people, it's a desk. Sit at a desk for long periods of time, or sat in front of a TV for long periods of time, with no or very little activity, whatsoever. And repetitive strain, when you're doing constantly same activity over and over and over again. And by that, I mean, bending awkwardly, twisting instead of bending your knees, you're bending your spine, and you're twisting instead of moving your feet, and all of that can cause repetitive strain, which then leads to wear and tear in your joints, which is where the gradual onset happens. So over time, the spine or the joints will start wearing out, and this is gradual increase in pain that you see. So initially you might experience just an ache, and then over the course of the period, this may become more of a soreness, and then more of a sharpness. It depends how many structures it involves. That can cause also, if there's a disc damage, that can also cause radiating pain down into your legs or your arms. So again, it depends on the amount of wear and tear. And I have got an image towards the end, which I'll show what a wear and tear may look like. But if you've got a disc bulge, you can imagine if that was the disc, if the disc is bulging out into this space. Now, this is the space, as you can see, where the nerves enter and exit from. Now, if that was to become narrowed because of wear and tear, or because of the bulge in the disc, or because sometimes wear and tear, so these bony contour here is nice and smooth, with wear and tear, it becomes quite sharp and rugged, which then puts pressure onto the nerve here, because the pointy bit from that bony part digs into the actual nerve bit and also into the disc, which can then cause an irritation into the nerve, which can also cause radiating pain into your legs or your arms. And if that space is narrowed, your nerves aren't able to move freely, which means that you've got a compression onto your nerves, causing radiating pain into your legs, and also impacting your nervous system. So things like, sensory loss, or loss of sense, loss of touch, loss of sensation, numbness, tingling, pins and needles, things like that. And again, that would depend on the extent of the damage onto those. Okay, so coming back to one of the causes. So one of the causes is our modern lifestyle. So not just office-based working, but our modern lifestyle involves a lot of sedentary working. So we are all very independent dependent on the technology. So we use laptops, mobile phones, iPads, iPods, and we're constantly on our phones, which means there is very less movement. Now, previously, if you look at kids, for example, they have, they were always encouraged to play outdoors, whereas now, because of the gadgets, they could sit on their gadgets for hours and hours and hours, and there is no movement, which means that they're not actually burning the energy, which is not affecting them mentally, but physically and psychologically as well, because that affects your social skills as well. And on average, adults spend about 7 or more hours sitting, and with the people aged 65 or over, it's about 10 hours or more of sitting down or lying down. Now, that could be because of the fact that they're in pain and they're not able to move much, which creates a vicious circle, because if you're in pain, you're not moving much, which means that it increases pain, which means that you're not moving at all. So that is where we need to consider breaking into that cycle so that you can have a balance of correct amount of movement and rest. So it's a Department of Health describes that inactivity as the silent killer, and that's true, because it's, as we'll see in the presentation as we go through it, that it affects not only your, like I said, your posture or your physical structure outline of the skeletal system, but it also affects internally your organs as well. And we will see later on how that will affect your organs as well, and also your mental health. So the guide is to move more and to sit less. So basically breaking up the sitting time with 1 to 2 minutes of activity. So that's the top tip. So if you're going to take anything from the presentation, is to try and move every half an hour for about 1 to 2 minutes. Okay, so talking about postures. So there's different types of postures. Now, if I was doing that in person, I would probably ask you which one you would relate to. There's many of you who are listening into this presentation. You could probably see that you fall into 1 or 2 of those categories. Now, very few of my patients have this, what we call the normal posture. Now, I have in my clinic, I have a posture screen analysis tool, which basically does the same thing. So it takes a picture from in the frontal position, so front from top head to toe, and then it actually takes a picture from the side as well. So from the ear, measures the measurements to the outer aspect of your ankle. And then what it does is it marks a few pointers on your body, and it compares your posture to this normal posture. And it tells you how many degrees or how many inches or how many centimeters you're out of alignment. And it tells you the measurements in the frontal view and the side view. And when I have done these talks in person, I have actually been able to take that gadget in and have been able to scan people who were interested in knowing how much out of alignment they were. And it's actually very favored amongst people, because it's an eye-opener. People who think they have a very good posture, they actually come to realization that it's not as good as they thought they were. So again, I'm not sure, and I'm not going to put any of you on the spot, but you know which posture you relate to. So whichever posture you fall into that category of, you need to remember that this is where you should be thinking yourself on. Now, most people will probably say that they fall into that bridge, arched back posture, which is again, and most of the time I see my when I see pregnant patients, most often they automatically have that arched back to compensate for the bulge in the front. Most of the office-based workers will probably fall into this category here, which is referred to as the spoon or flat back, rounded shoulders posture, because they kind of adapt that rounding of the shoulders because of the repetitive, adapted posture of sitting at a desk with their chest, and shoulders forward, and having their arms on the keyboard. And again, later on in the presentation, we will go through what's bad posture at your desk and what's good posture at your desk as well, which again, something to take away. So here we go. So poor posture and ergonomics. So again, I'm not going to put anyone on the spot. How you could probably all relate to those as well. So this is what I was talking just now. So most often you'll see people will either sit with quite a relaxed position, what I call the slouching, and you can see there is no support whatsoever. And this is not just for office workers. Now, during the pandemic, I have treated a lot of children. Reason being, during the pandemic, a lot of children had to work or study from home, and they're on their laptops, constantly on their laptops, and they don't actually have a good setup. So you'll either see them in this sort of posture or in this sort of posture. And even when I've gone to schools and things, you'll see a lot of youngsters slouching, even at home on the sofa, slouching. And it's not just youngsters, it's us adults as well. Even if we're watching TV, we kind of adapt that posture. If we're at work, we're adapting that posture. And can you now see your spine? So if you think about the picture that we had earlier on, your spine is designed to be that subtle S-shaped curvature. Now, this is where you're straining. And can you see the amount of load on your spine here? And this is when this person is then going to come and be complaining of their lower back pain because of the repetitive strain and load through these segments here. They're also, their angle of the arm isn't quite right. So they're going to get repetitive strain injury in their arm and wrist and also shoulders. So they're going to have more rounding of the shoulders, which is going to affect their neck. So ultimately, they're going to end up with a posture looking like this. So this is where your head should be. So this is your ideal posture, but this is what an adapted, chronic forward head posture becomes when we spend too long in this sort of position here. So you've got your slouching posture, you've got your poking chin posture, you've got your hunching posture, and then you've got your straddling phone posture. So again, in person, I probably would have asked how many people work in the office with one phone in between their ear and shoulder and typing away as they talk. And this, as you can see, if you remember the spinal structure, can you see how this is going to add compression onto your spinal segments, onto your vertebrae, onto your joints here? And this is what I mean about repetitive strain, which causes wear and tear over time. And then that acute problem then becomes chronic over time because it's constantly same problems over and over and over again. And as you can see here, the areas which are going to get affected are your mid-back because of the curvature here, and then the lower back, which is again curved. So you're compensating your spinal structures the way you're sitting. There's no support here. So you're having to sit the way you are. And then as we'll progress through the presentation, we'll see how this will then compress your internal organs, also causing strain on your internal organs. So not only then are you affecting your spinal structures, but also internal organs as well. There is actually, so this relates to, there is a new, I'm not sure how many of you have heard it or have come across it, but it's actually a clinical diagnosis called text neck. And that's because we spend constantly our head in that forward head position, on our phones. And most often it's youngsters, but it's becoming more common that everybody, regardless of the age, is becoming more and more prone to those sort of postures where they're adapting and causing strain and wear and tear over the joints. And it's worse for younger people because they have a lot of wear and tear. And by the time they get to an older age, their joints have worn a lot more, considerably a lot more than they would have if they'd carried on with their normal activities. So as I was saying, so this clearly shows you what other effects where your body gets affected. So as I was mentioning, it not only affects your spinal structures, but your internal organs as well. So you get eye strain, constantly staring at a screen without without adequate breaks, and then you've got because of the way you are sat, you're compressing your chest and you're rounding your shoulders, which is going to affect your pulmonary system, so your lungs, and that can lead to difficulty breathing because of the compression on the lung structures. Coming down, because of the slouched position, you're going to compress all of the internal organs, and that's including your stomach, your liver, and no wonder you'll have sometimes you'll probably wonder, why do I suddenly start? I've never had gastric reflux. I've never had any problems in the stomach. You'll probably feel that, you get that mid-thoracic pain in the chest radiating to the back. And that's probably just to do with the gastric reflux. And you'd wonder why suddenly you started getting gastric reflux, but you wouldn't actually associate with the way you are actually putting strain on your body that's affecting. So your day-to-day activity actually depends what you're doing is actually causing effect on your bodily systems. So then headaches. So again, going back to that slide earlier, we saw the forward head carriage. So if we go back to that slide, oops. So that forward head carriage, so you can see how many musculatures it involves, and that's going to cause headaches because of the tension and the pressure, not only just in the joints, but in the musculature as well. And then neck and shoulder pain, which I've talked about earlier, and then lower back pain, which again, I talked about earlier, and also impaired blood circulation. So again, sometimes you wonder why, your vascular system has affected recently, but again, you wouldn't relate to the way you are doing your day-to-day activities. And that can affect that, and which can in return affect your cardiovascular system. So, sitting too long, it affects your heart, your stomach, head, arms, and legs. So like, as I was saying earlier, not only does it affect your structures in the spine, but all the internal organs, and also your mental, general mental and health, well-being as well. So health and well-being comes importantly not only physical but mental as well. So this is what I was referring to earlier. So there's different types of changes. So when I was talking about these very first slide, explaining the normal anatomical structures. So if you look at these, so this is the big bulk of the bone, so referred to as your vertebrae. These are your facet joints, which are another area which can be affected. In between is where we saw the nerves exiting and entering. So this important space. And then there's different types of changes that can happen to your discs. So this, for example, is your normal disc. This is when the disc starts bulging. So it either bulges in the front or it can bulge at the back. It's a bad news if it bulges at the back, because that's going to narrow your space for your nerves to enter and exit, which can give you radiating pain patterns in your arms or legs, depending on which nerve is affecting. The other one is herniated disc. So again, when the fluid, so this disc, if I was to cut that disc open, there's lots of obliquely lined, what we call the fibers. Now, every single person, including myself, will probably tear a few fibers a day. The problem occurs when you have the fibers tearing in the same area over and over and over and over and over again, which causes weakness in that area, which then causes the fluid inside the disc to leak out. So again, that's the bad news too, because if this liquid starts oozing out of the disc, not only it's a clinical emergency, but that's going to affect your nerves big time, and that's going to really cause nervous system problems. So this is when it needs operating on. So this is where, like I said, it's a clinical emergency. So fibers, a bit like hair fibers. So you can you get hair fall out. You don't really notice, but you start getting thinning in one particular area, and eventually baldness if you get the hair falling out in the same spot. Over a period of time. And this is exactly what happens in the disc over time. Micro trauma to the area causes weakness. Eventually liquid starts oozing out. And this is what the disc looks like when it's degenerated. And by degeneration, it's basically another way of saying wear and tear. So this is where the disc will start wearing. So as you can see, instead of having round, smooth edges around the disc, it now has ridges, and it's not as smooth structure as it was. And then that causes dehydration in the disc, which means that you start getting reduction in the disc height, and it starts thinning the disc down. So this is what normal spine would look like, and this is with the degenerative changes. And as you can see, you get rugged areas, and it's quite and these sharp areas here, which I was referring to earlier, they can dig in to the nerves, as you can see, and that can affect the nervous system as well. And if we were to look at on an X-ray, this is what would look like. So these bits here, so earlier, as I was saying, you get the smooth bony contours around the vertebral bodies, but suddenly you get this sharp pointy edges. So the bone, what we refer to as the bone spurs. And this is here. So this is a normal disc space in between the joints. And this is where you get the narrowing of the joint disc space. And as you can see, it's almost like a lipping effect. So you get bone bulging downwards and a bone bulging upwards, and it kind of formulates that bulk area, which again can impinge into the structures in the front. And sometimes, people say, oh, I have difficulty swallowing. Now, there may not be anything wrong with their esophagus or the feeding tube. It could just be because of this bulginess is pushing into that tube, the feeding tube, which is narrowing the width of that tube. So as the food bulk comes down, it gets almost, because of the narrowing, it affects it. And that could be not just a narrowing in your esophagus because of the structural changes, but also because of the changes in your spine. The other thing is, if you get these sharpening edges, as I was saying, happening at the back, this is where it's going to start impacting the space here and pinching on the nerves, which again is going to give you the symptoms that we talked about earlier. So how can we prevent back pain? So having talked about all of the, the things that we are doing wrong or maybe doing wrong. So if you're going to take anything from the presentation, these are the things I would suggest you do. So avoid sitting for too long, whether it's at work or at home. Stay active, and we'll talk about areas or different things where you can stay active. Now, what I always suggest and recommend that people do is activity within their own limits. By staying active, you don't have to just go out tomorrow just because, oh, Sarah said in her presentation, we've got to stay active and go out and do a marathon. I'm not saying that, because everybody's got to find their own. So it's always within your limits of what you can and can't do. So regular break from if you're at work, you've got to take regular breaks and you've got to do back exercises and stretches. Think about your posture. Mattress is also a massive factor in your neck and back pains. If you don't have the right mattress, if you don't have the right pillows, that can add or contribute to the problems that you may already have. Being overweight and health risks can also add to the the pains that you're already getting. So a lot more wear and tear on your joints if you're overweight. And to reduce the prevention of the pain would be to consider those areas and stay positive. So activity levels. So according to the Health Organization, regular activity, now it will depend on a child, young adult, and older adults, but about 150 minutes of varied activity over a week. Now you could do a vigorous activity, or you could do a moderate intensity, so things like brisk walking, water aerobics, riding a bike, dancing, and more intenser activities, things like jogging or running, swimming, riding a bike, or taking part in sports. Now, like I said earlier, moderation, so any activity you do, it has to be within your own limits of what you can and can't do, and within moderation. So you can't, to stay active, you can't like say, I'm going to train in the gym 7 days a week. No, because you need, variation of light activity, moderate activity. So maybe one day you might do some cardio. So go for like a 23-minute walk, and the next day could be like your rest day, do some stretches, some strengthening exercises, and then the day after maybe go for a swim or something. So it's just kind of trying to find what works best for you. I always say to people that are working in the office, if they are back in the office, it's to use the staircase rather than the lifts. Small changes in the activities, go out for a walk during their lunch break rather than sat at their desk eating lunches. And I have found that during the pandemic, because of the change in their routine, most people have found it very difficult to stick to a regime, because there has been changes to their activity. So for example, that if you're sat at home working from home, you probably find that you don't get that adequate lunch break, because at work you get that set hour or 30 minutes for lunch break, whereas at home you kind of work through it and eating in front of your desk, which again is a bad habit, and it kind of needs to change, because you need to move around every half an hour to 45 minutes. So again, the strength and conditioning. So I always find that stretching as well as strengthening exercises are equally important. Some patients may say, yeah, I've done all those stretches, but how about strengthening? You need the adequate strength in your muscles to support your joints. So you need to stretch the muscle to keep it nice and supple, to have the flexibility in your joints, in your muscles, but you also need the strengthening so that your muscles can support your joints. That could be strengthening exercises, could vary again depending on whether you just want to do some resistance stuff, some weight stuff, or just some Pilates, just to kind of build up the strength. So this is what the Royal College of Chiropractors recommend. So gardening, but again, if you do the gardening adequately, that counts as your activity. But most people don't realize actually that gardening works a lot of your muscles if done properly. Cycling has been mentioned, swimming, weight sports, walking, and using the stairs, like I said. So 30 minutes of activity, and as you can see, it reduces your risks of 30% dementia, all causes of mortality, cardiovascular disease, depression, and type 2 diabetes. So these are benefits of physical activities, that it actually helps with your health and supports you, not just mentally, but physically as well. So how can you build strength? So again, you could do at least 75 minutes of vigorous activity or 150 minutes of moderate activity. And these are just some of the examples of what you can do So breakup periods of inactivity. So, you just need to kind of go for a little walk. You need to start improving your balance as well. And these are just some of the benefits. Improves sleep, maintains healthy weight, it manages stress, improves quality of life, helps with type 2 diabetes, cardiovascular diseases, falls, depression, etc., joint and back pain, cancers like colon and breast cancer. And that's proven through research that it actually helps to reduce those areas. Okay, so again, another, like I said, mentioned many times during the presentation, not only does it help with your physical well-being, but also in mental well-being, as well as individual development. So there is actually good evidence that it helps with all of those areas that we've been talking about. And again, as I mentioned before, people think that actually exercise, I've had a lot of people say to me, I don't want to exercise because I'm in pain. But if you think about it, your joints, so when wear and tear happens, as we've talked about it, with wear and tear, your joint space reduces. And this is what happens in osteoarthritis. So osteoarthritis is just a wear and tear in your joints. And when the wear and tear happens, your joint space starts reducing, the cartilage starts breaking down, and then you start losing the cartilage. With exercise, again, independent of the person and what's suitable for them, it actually helps improve your movement and flexibility and mobility in the joints, because what you're doing is with the gentle exercises is you're allowing the joint to keep mobile, you're allowing the joint to keep hydrated and lubricated, because the discs, like I talked about, they contain fluid. So these are what keeps the discs hydrated. Likewise in your joints, so talk about your hip joint, talk about your knee joint, talk about your ankle joint, or your wrist, or your elbow, or your shoulder. They have cartilage in them, or bursa, which is a fluid-filled sac. And this is what keeps the joints hydrated or lubricated. So if there is, if that fluid isn't being pushed around the joint, they get very stiff and they get very hard. So people who suffer from, say, osteoarthritis or wear and tear, they probably say that they wake up in the morning and they feel really stiff first thing in the morning. And then as they, start moving around, they feel that the joints loosen up. And that's because during the night, there is hardly any movement, which causes dehydration in the joints because the fluid isn't being pushed around, so that your joints aren't being lubricated. And this is why you feel stiffer first thing in the morning. And as you start moving around, because you're pushing the fluid around the joints, that's bringing in the lubrication into the joints, making them mobile again. And then you're a bit easier to move a little bit better. Some patients will say, especially if they're suffering from back pain, they get locked into that bent position, and then they find that actually it takes them a little while to straighten themselves back up, especially if they've just stood up from a seated position. And that's the same principle. When you sat down, you're compressing the discs, you're loading the discs, and because gravity pulls the fluid, or gravity will pull anything down, so when you sat down, your fluid is being pushed down towards your feet and it's not being pushed up. So what you've got to do, remember, is you've got to make the fluid move against gravity. And the only way you can do that is through movement, which is why movement is important, because you've got to allow the fluid to move around, push up against resistance, so you can keep your discs and your joints hydrated. Prevention or reducing the risk of hip fracture. So again, same sort of principle. If your joints are dehydrated and they are brittle, they're more likely to break, whereas if they're supple, they won't break as easily. Type 2 diabetes, because again, like we saw in the slides earlier, if you're sat down for too long, it compresses your organs, it causes weight gain, which can lead to type 2 diabetes. And again, we saw on that slide, coronary heart disease. So again, if you're sat down, it's going to cause a vascular problem. So vascular problems and also problems with your heart. So your vessels aren't going to be working as, again, coming back to the point of your fluid not being pushed against a resistance. So again, depression, dementia, which we mentioned, and that's again, just about mental health and well-being. So evidence suggests that physical activity, excuse me, leads to healthier, happier life. It boosts your self-esteem, mood, sleep quality, energy, and reduces stress, depression, dementia, and Alzheimer's. What else? And some people, like I was saying, may say, oh, but exercise, I can damage myself in doing exercise. Yes, you can. And that is if you, like I mentioned earlier, overdo the activity. So if you go out training in the gym 7 days a week, heavy weights, and you've not been in the gym, of course, you're going to damage your back or your spine or whatever area that you're training. Or if you go out for a run tomorrow and you haven't run in like 10 years, of course, you're going to hurt yourself. So it's working what works best for you, finding what works best for you, and gradually. So it's almost training yourself and taking baby steps. So, babies don't learn to walk before they can crawl. So, starting to find what works for you and then gradually getting yourself into a habit of gradually increasing the activity. Okay, how chiropractic care can help. So like I've mentioned throughout the presentation, I treat a lot of musculoskeletal conditions, so back pain, neck pain, sports-related injuries. And the aim of the chiropractic care is to not only educate the patient about their health condition, but also do some manipulative therapy to reduce the pain, improve their range of movement and flexibility, and also give them prescribed exercises which will help with their mobility, with their flexibility, and also that will add a bit of strengthening in their muscles required to sustain the structures and get the optimum function from their joints and their muscles. And I also do acupuncture as well, which I find works really well with the chiropractic treatment because it helps alleviate any pressure, any tension in the muscles as well. So this is what I was referring to. So these are my top tips. So if you're going to take anything away from today, it's learn how to sit properly. So these are the points we talked about, and these are the areas highlighted in red is where I see most people come to see me for problems with musculoskeletal. So jaw pain, because if you're stressed, if you're tense, you're clenching your jaws, headaches, neck pain, shoulder pain, mid-back pain, lower back pain, ribs as well, hip pain, elbow pain, wrist pain, so repetitive strain injury, and also knee pain. And this is how you should be sitting correctly. So your back should be supported, your hips should be in line, slightly higher than the hips, and your arms should be 90 degrees as well. So resting your elbows and arms on your chair, armrest or desk, your buttocks should touch the back of the chair. If need be, you can always put cushions or pillows to reduce that gap. And then your feet should be firmly on the floor. If you find you can't get your feet on the floor, you can also get like a footstep or a wedge to bridge that gap between the floor and the foot to try and get that 90-degree angle here. And this is how you should be sat at your desk. So if you're working at a desk, so the height of your screen should be roughly at the height of your eyes. You should avoid, so the picture that we saw, cradling the phone between your ear and your shoulders should be nice and relaxed and pushed down, and you should keep your wrist straight whilst typing. Sorry. You can get, so during pandemic, I had a lot of patients come back and say, oh, because they've been working from home, they don't have the correct space to have a good desk setup. So I've actually helped them make use of whatever they have at home to make it the best they can for a good setup. At work, of course, you have all the facilities available, and the employers, this is why I do the ergonomic assessments, so I can go back and do a report to the employers, so that they can provide the correct help to the person that's needing. And some patients will say, well, I don't have a computer, I work from a laptop. Well, if you get a separate keyboard and your mouse, you could do. So these are the top tips for your for those who don't have who don't use a computer, but they use a laptop. So if you have a laptop on a workstation and you find this too low, just put some if you're working from home, anything that you can find around the house, an empty box or reams of paper, just put that under the laptop, and then all you need is just a separate keyboard and a mouse, because then you can have your arms nicely rested on the surface to then create that environment. And then obviously that's sit properly. So again, if you're sitting at home on a dining table, chair, just make sure that you use a cushion or a pillow to put behind your back so that you can be supported, using a footstool if necessary, to help you bridge that gap between the floor and your foot. At work, most of the workplaces now do also offer the sit-stand desks, which are good, because you can then move between a sitting position and a standing position, which works really well because you're not sat in a static position, or you're not stood in one position. Because the problem I've seen with either of those is if patients are sat on the chair, they sat for too long, or if they're stood up, they stood for too long. And the problem with that is if they're stood, they tend to, and again, most of you will say yes to this if I'd asked you, is you tend to stand or put your weight through one hip then rather than standing with the weight going through both feet. And again, that's another tip. When you stand with both of your feet planted forwards. And most of the time when I do the posture and the spinal analysis, what I find is most of the people stand with their knees locked. And again, that causes pressure in their spine, but also they're then hinging from the spine rather than the pelvis. So your pelvis should be in a neutral position, and you should have a slight bend in your knees, so that you're not, and you should be just rocking from your hips rather than rotating from your hips. And the slight bend in your knees makes sure, or allows you to have a weight bearing equally going through both hips, rather than standing on through one side compared to the other and loading one side. And again, this is where you're going to start affecting your spine and your hips, because you're going to put more wear and tear through one side of the joints compared to the other. So some of the stretches that you can do at work or at home, if you have a home setup, they're quite easy to do. So literally just sitting down, just opening up your chest, because you spend such a long time in that hunched position that it's nice to just open up your chest to allow for your what we call the pectoral muscles to just stretch out, so they're not so rounded, causing a pull on your shoulder blades. And just a gentle turning just to stretch out your spinal structures and your upper back, and then a side alternating stretch just to stretch out the muscles on either side of your rib cage as well. And then stretching these big chest muscles around the front. And again, like I said earlier, when you're sitting forward in a slouched position, these muscles get shortened and tighter. And what you've got to remember is when you have tightness in your muscle will get shorter, which means if your muscle's shorter, because it's attaching to the bone, it's going to pull on the bone. And that's going to, again, over time, cause wear and tear because of the repetitive strain, which is why stretches are important, because it lengthens the muscle back to the length of the muscle it should be. And also, it helps to keep the flexibility in the muscle, so it's not causing that unnecessary strain on the muscle and the joint that is attached onto. Got a couple more stretches. So again, you can just stretch out your mid-back area, and then some neck stretches. So just like side to side stretches, just to stretch these structures on either side. You could do some hip stretches, and you can do some side muscle stretches here. And these are just sent because you could do them sitting down, you could do them stood up. And when I prescribe exercises to my patients, I always take into consideration their activity and their lifestyle, their work habits, just so that we can design the exercise. And there's no point, suggesting you do a list of 20 exercises and send you away with 20 exercises, because I know it's never going to happen, because you're not going to have 20 minutes of your time to do those, because everybody has such a busy lifestyle. So I always say to my patients, I always try and give them 1 or 2 at a time, and then gradually build on those exercises. And I always modify them according to the person, so that they can fit into their daily routines. For example, do a stretch whilst you're waiting for the kettle to boil. Do a stretch whilst you're waiting to collect something from the printer. Do a stretch whilst you sat in the car, at the traffic lights. There's so many different ways of introducing exercises into your daily routine that actually, the more you do, it becomes a second habit, and you do it then without realizing. And that's it from me. Any questions?
I'll put my video back on. If you have any questions, you can also put them in the chat as well. It's actually...
Sorry, go on.
No, what were you saying?
I was just going to say, I've just seen the chat, and I've got rheumatoid arthritis, fibromyalgia, degenerative disc, arthritis, fibromyalgia.
While you were talking, I actually grabbed my laptop stand and my Bluetooth keyboard and mouse.
Excellent.
I was making the adjustments as you were speaking. I was just like, whoa, oh my gosh. I mean, that was really, really insightful. I learned so much, because I'm definitely one of those. I feel like I'm actually 2 of the postures that you... Really? Yeah. And I was actually wondering if that's possible to actually have 2, 1 or more of those postures.
Yeah, no, this is what I was saying, at the start of the presentation, that, that posture analysis, when I do the face-to-face, or when I have done the face-to-face talks, I take that gadget along, and it's amazing because it actually shows you the points. And it's like you said, it's an eye-opener, because you don't actually realize, because we go through day-to-day, it becomes... your adapted postures become your second habit, and your bad habits become your good habits, because they're easy to do and so hard to get rid of. And then when I do actually try and put the patient in a perfect posture, they will often comment and say, this feels odd. I'm not going to walk around like this. And you're like, well, because your adapted posture is now your norm, and you don't actually realize what the good posture is. So
yeah.
So I'm just going to answer some of these questions. So rheumatoid arthritis. So with rheumatoid arthritis, slightly different to your osteoarthritis. So your osteoarthritis is more, wear and tear in joint, and your osteoarthritis most often affects one joint, whereas your rheumatoid arthritis is inflammatory arthritis. So you have inflammation in your joints, which can affect more than one joint, and most often it affects both joints. So both hips, both feet, both hands, etc. With the rheumatoid arthritis, I think the most, I would recommend and suggest kind of managing it with gentle exercises and mobility, because it's important to keep the joint active. and to keep the joint mobilized so you get more movement and more range of movement through the joints, because you get lots of stiffness. And with rheumatoid arthritis as well, as it progresses, you get deformity in your joints, and again that can be quite debilitating. So early preventative measures and management can help to kind of reduce the chances of progressing the condition worse than it actually is. So I actually see a lot of patients with fibromyalgia and jointed disc. So again, like I was saying, so fibromyalgia is it's where you kind of have what I call, the patients say they have good days and bad days, so they'll have their flare-ups. So again, with fibromyalgia, it's very important to have the correct management. Now with fibromyalgia, most often I've seen that it affects your upper back, so your shoulders and your hips and your back. So this is where management is important. So I see a lot of patients with chiropractic care can help with helping to manage the condition a bit better, because you can have more range of movement, you get more flexibility, more mobility in the joints. But with the exercises, that will also help to keep the joint aches and pains at bay, because you're moving through the joints better, and you've got more flexibility and strengthening in the muscles as well. So degenerative disc we talked about. I hope I've covered everything. Arthritis or knee and shoulder surgery. So depends. So arthritis, again, as I was saying during the presentation, is wear and tear in the joints. So in the knee, you get wear and tear with the arthritis, and most often is the inner part of the knee gets affected. And again, as I was saying, is due to your posture. So most often patients or people will load through the inner part of the knee more so than the outer aspect of the knee. And that's because most people, if you notice, you have flat feet. And if you then, after the presentation, go away and have a look at your footwear, you will actually see where your shoe wears out more compared to the other sides, and you'll see the edges of where the shoe wears out, and this is where your load goes through more than the other side. So with knee, most often the pain is due to that meniscus, that wear and tear in the meniscus, the cartilage. So again, losing the cartilage, which is, and then the liquid, which is a lubricator, and then the joint space starts reducing, and then that causes pain. So shoulder surgery depends what sort of shoulder surgery you've had and what the shoulder surgery was for. Again, post-surgery, you can actually have sometimes, depends when you've had the surgery, you can have early signs of wear and tear in the joints post-surgery. So again, it will depend on, so maybe if you wanted to talk to me and explain me a little bit more, I can give you a bit more insight into what can and can't be done with the when it comes to prevention management side of things. So I'm just reading your messages. So again, I've got message, fibromyalgia may leave, but have great interest in the pain management and work on a project to destigmatize mental health and open more conversations with that side. But I'm here today to focus on the chronic pain management side of things. So I hope I've covered what you wanted to hear, but if there's anything that you want me to go through or work through with you, I'll be more than happy to kind of discuss that further. So I've had a message from Neil. I joined late and was wondering if you recommend staying away from inflammatory foods or substances. It depends on why you would want to stay away from inflammatory foods or substances. Is that because you have an inflammatory condition? So again, if you want to expand on that, then I can give you an answer relating to your question. Okay, so Karen, you had 4 ribs out due to thoracic outlet syndrome. So I went in first. Any exercises you could recommend for that? Now, again, I'd need to know how long ago you had the ribs out, and your thoracic outlet syndrome, and what sort of symptoms are you still experiencing, because your exercise, again, is not, what I don't like to do is one size fit all kind of things, because there are some generic exercises that you can do for thoracic outlet syndromes and cervical spine and the first rib, but and obviously for the mobilization of the ribs. But I would like to know what the thoracic outlet syndrome, when did you have it? Did you have any treatment for it, etc.? And so that I can kind of discuss that more with you. Yes, okay, so any extra advice of exercise, sleep position, other pain management for bone spur in the neck to prevent it getting worse? Yeah, for sure. So the exercise most often, I think the most important exercise would be to do something called the chin tuck. So it's chin and then T-U-C-K, tuck, which is basically to help reduce the amount of stress and the strain at the back of that. And literally it is, you can use your fingertips, so you can literally just push the chin back like so, or you could just have your head and then pushing. So you're almost trying to create a double chin, and you could add a bit of resistance. So you could have a towel or a pillow underneath your head and you're trying to push your head on top of that, or you could use a wall and you push your head. So you almost, it's anything that's going to create that movement. And you can do that chin tuck as many times throughout the day as possible. I would recommend only using one pillow when you're sleeping. Any more pillows, you get that change in your spinal structure. So if you get, say, for example, 2 or 3 pillows, you have one pillow, with the 2 or 3 pillows, your head posture will change. You get deviation or curvature in the thoracic spine, and then your lower back isn't actually supported. So one pillow, so that you almost are horizontal and all of the structures in your spine are supported on the mattress. As for the posture, sleeping position, side posture is the number one posture to keep your back in a neutral position. So either in a fetal position or a recovery position, and should you wish to, you could put like a thin pillow or a cushion in between your knees to take the pressure off. Ideally, definitely a big no-no for front sleeping, because that's going to cause more back pain in your spine than necessary, and that's a big no-no for front sleeping. Back sleeping, it's okay, but again, one pillow and pillows underneath your legs to bring your legs up so that your back is supported on the mattress, so you don't have that gap or a dip in your back. Any other exercise for the bone spurs? So again, you could do the side bends, you could do the stretches around the side, so your upper trapezius stretch, and there's many other strengthening exercises. So you could do some resistance band exercise where you're strengthening around the neck muscles as well. Okay, Karen, so you roll your shoulders forward due to the chronic pain. Last surgery was in 2006. Okay, so your chronic pain, I'm assuming, is around the mid-back area. So rolling shoulders, I'm assuming it gives you that relief. So you could do, if that's the...
I also put in one right after that, because I regularly swim and do yoga and stretch and do wee and all the other stuff.
Oh, okay, yeah. Okay, yeah, seen it. Okay, stay with your microphone up, because I can talk to you if you don't mind kind of talking whilst everybody's hearing. Basically, what I would suggest is obviously yoga stretch. You probably heard of the cat cow or the the cat stretch. That's quite a good stretch. Now, with the thoracic outlet syndrome, I think you probably been explained. Thoracic outlet syndrome is when you've got your nerves being pinched here, and that causes symptoms in your arms and in your back as well. So anything that's going, so you probably will benefit from what I call the pectoral stress. So one of the stretches we saw on the sheet to stretch out. So what you want to do is open up this bit of the spine here, or the shoulders, the chest area here, to allow for the nerves to free up a little bit. you could also do what we call the nerve flossing test, where you kind of have your arm out and then you're just having the palm facing up to try and stretch out your nerves as well. You could also, do some it's like the child's pose or the prayer stretch to stretch out your spine. And how you're finding with doing the swimming and yoga and stretching, has that been helping you? Okay. Have you ever tried Pilates? Right, okay. Pain is too great. You can actually do, if you have the Pilates teacher, you can actually like speak to them and they can actually offer you one-to-one, and they can modify. There's a lot of the stretches that they can modify. Have you seen a professional? Like, have you seen a chiropractor to help you with the, to get rid of the underlying cause first and the chronic pain, so that you can, because what you need to do is break into that vicious circle. So if you've got that chronic pain and that's limiting you, so coming back to what I was saying earlier, if you're in pain, you're not going to do your activity, and if you're not doing your activity, you become less active, which means that increases your pain. So you need to kind of get your pain levels down so that you can do appropriate exercises. So have you considered possibly having some acupuncture or seeing a chiropractor? Okay, no problem. Anybody else with any questions? Have you found that useful? Was there anything else that you want me to go through or cover, or anything else?
All right, I think if no one has any more questions, then I think that we can close this up then. And then I can put in the chat. Oh, let's see. Someone said, oh, okay. Amazing.
Oh, thank you. I'm glad it's been helpful.
So I'll go ahead and put in the chat. If you'd like to learn more about Samera, or maybe book a session with her if you're located in the UK. Do you offer any online sessions?
Yeah, I do.
Perfect. Right. So then, yeah, if you're not located in the UK, you're still able to connect with her.
Yeah.
And then you can do that there. So I put in the 2 links. You can book her on the Zaya platform. We have a directory. And then, or you can go to her website directly. So yes, amazing.
And there is, there's a, if you find it easier, it's on the Instagram, there is an Instagram as well, if you wanted to connect through that.
Oh, yeah. Perfect. All right. Well, thank you everyone so much for coming. I really appreciate it. And if you have any questions, then feel free to reach out to myself, or you can reach out to Samera. And if you'd like to learn more about the project that I am currently working on, you can go to our website, which is zayabmed.com. You can also join any other future events or workshops like this one as well. Just go to zayabmed.com/events. All right. Amazing. Thank you, Samera. Thank you, everyone. All right, connect with you all soon. Bye.
Bye.